Today, I'm going to answer your burning questions about all things health and medicine related from some of my past YouTube videos. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. Ask Dr. Frida medical questions and answers. These are questions and comments that have come from past YouTube videos, and I'm going to answer you now.
What about your pulse reading? What role does it play with high blood pressure?
Oh, that's a good question. Okay, Willie. So when you say pulse reading, you're talking about the heart rate. And yes, on that blood pressure machine, you often will see the heart rate. Now, it's going to vary from person to person. Make sure you consult with your physician. But for most adults, a normal heart rate or pulse reading is between 60 and 100. If it's well over 100, that's too fast, tachycardia. Well under 60, that's too slow, bradycardia, especially if you have symptoms. Here's the real key. For a person who is taking blood pressure medications or who may need to take blood pressure medications, some of these medications will affect your heart rate. And so it's important when you're reporting your blood pressures to your physician, you let them know that pulse reading, because depending on the pulse reading, they may or may not be able to give you certain medications. The other thing is that if you have very low blood pressure or hypotension, you may have a high pulse rate, and having that information will help your physician to know.
Are you from Nigeria? From Juliet.
Juliet, I get asked that question all the time. And the answer is no, I'm not from Nigeria. I get asked if I'm Nigerian, specifically if I'm Igbo. But to be honest, I only know my history back so many generations. So it is quite possible that my roots could be in Nigeria. I need to do a DNA. I've never done a DNA. But no, not Nigerian. I was born in the South, Augusta, Georgia. So I'm one of the grits, girls raised in the South.
What causes one number to be higher than the other? From Jasmine.
Okay, so what causes one number to be higher than the other? So the systolic blood pressure is the pressure within the blood vessel walls when the heart is contracting, right? And so that's when you're going to have a higher pressure, a greater force. That number is going to be higher. The diastolic blood pressure is the pressure or the force within the blood vessel walls when the heart is relaxed, okay? So there's less pressure, so that number is lower, and that's why. And which number is more important? Well, it actually depends on your age group. And so if you make sure that you listen to that video, systolic versus diastolic blood pressure, which one is more important? I go into detail about which one is more important for you, but spoiler alert, they're both important. You both want them both to be within a normal and healthy range.
Can congestive heart failure be cured/reversed?
Stasha, this is such an important question because amazingly, in many cases, yes. In fact, I was just talking to one of my patients with congestive heart failure, and he was on a point where the way that his heart pumped was so low that he actually had to get a defibrillator. Okay. He had severe congestive heart failure. But after going through certain things like getting on the proper medications, getting to a healthy weight, having a low salt diet, and doing some various things that his heart failure specialist has had him to do, and, doing different treatments that I've had him to do for his high blood pressure, his congestive heart failure has improved immensely. It has not totally corrected, but he's gotten to a much, much safer stage. And so congestive heart failure can be improved, and some of those really, really low numbers can be reversed. Will you have a 100% cure? Not necessarily, but please, if you have heart failure, make sure that you consult a cardiologist and specifically a heart failure specialist.
How do I get your book, Under Pressure, from Judy?
Judy, you can get my book, Under Pressure, A Guide to Controlling High Blood Pressure, by going to Amazon, and make sure you put the whole title, Under Pressure, A Guide to Controlling High Blood Pressure, by me, Dr. Frida, or you can go to my website.
What if you have some of these symptoms, but your blood work says your kidney levels are within normal range? From Mona.
Mona, that's such a good question, because here's the thing. A lot of the symptoms of kidney failure are non-specific, meaning you can have them from kidney failure or something else. For example, you can be nauseated with kidney failure. You can also be nauseated if you're pregnant, or nauseated if you have reflux disease. So the point is to see your physician and rule out the things that it is not. Now, if they've done your complete kidney workup, your BUN, your creatinine, your GFR, all of those things, and they're sure that you don't have kidney disease, but you're still having symptoms, then talk to your primary care physician about looking for other things that can cause some of these overlapping symptoms.
What happens if you choose to do nothing? From Judy.
Judy, if you choose to do nothing about your kidney disease, a few things can happen. One, you can continue and just progress through all of the stages of CKD and go all the way to CKD stage 5, which is the level where your kidneys are functioning less than 15%. If you get to this level and your kidneys are not functioning, if they completely fail, if your kidneys stop working, you stop making good urine, and your electrolytes become out of whack, you cannot live with kidney failure unless you have some form of kidney replacement therapy, such as dialysis or a transplant. You have to have at least one functioning kidney in order to live. And so I do have patients who choose to do nothing, like patients who get to the point where it's time for a transplant or dialysis, and they say, you know what, I don't want it. We talk about it. I make sure that they're of a good mindset. And if that's truly their decision, I support them, and we ultimately transfer them to hospice. Now you have other patients who have acute kidney injury, meaning it's just a temporary kidney disease. And sometimes it can reverse. I don't recommend sitting around and kind of, waiting for luck or just kind of trying to see if it's going to change. I recognize that you go to your physician, your nephrologist, and if there are ways to reverse it, I recommend that you reverse it so that you can live. But ultimately, the answer to the question is, if you truly do have kidney failure, and if that kidney failure progresses and your kidneys stop working, you cannot live unless you have some form of kidney replacement therapy, dialysis, or a kidney transplant.
Is a cucumber considered a fruit? By Sneakers and Fitted Hats 77.
This is an age-old question. Is a cucumber considered a fruit? And I was taught that if a fruit, vegetable as some may call it, if it has seeds, then it's a fruit. And so a cucumber has seeds, and so I would think it's a fruit. A tomato has seeds, it's a fruit. Even though, they're not sweet, we don't think of them as fruit. That is really a good question. What I can tell you is that cucumbers are an excellent source of nutrition, wonderful plant-based food, and it's one of the foods that can help to lower your blood pressure naturally. It's a low sodium food. Is a cucumber a fruit? I think yes.
I know high blood pressure can contribute to kidney problems, but can it work in reverse also? Can kidney dysfunction create high blood pressure? From Mike,
yes. What came first, the chicken or the egg? High blood pressure can cause kidney failure, as you stated, and kidney failure can cause high blood pressure. You're absolutely correct. And sometimes it's hard to know which came first, but I can definitely tell you that if you control your high blood pressure, then that can decrease your risk of progressing to kidney failure. And if you do progress to kidney failure, if you do things to try to improve that kidney failure, that can help with your high blood pressure. But you got it just right. What came first, the chicken or the egg?
What are your thoughts of adding flaxseed supplement in your morning diet? From Prince,
that's a good question. And flaxseed, that's something I talk about because that's a way that you can help to lower blood pressure naturally. Flax seeds are a pretty healthy supplement or food, but here's something that you have to be careful of. Flaxseed can contain a lot of phosphorus. And if you are a person with CKD or chronic kidney disease, and if you're a person who has end-stage renal disease on dialysis, it's important that you limit your phosphorus, in most cases, to less than 800 milligrams a day. So bottom line, flaxseed can definitely be a healthy choice, but you want to consult with your physician because flaxseed is not for everyone. This was fun. I hope y'all enjoyed it. I certainly did. And if you found this video to be helpful and informative, please be sure to share it with the people you care about. Again, if you have any questions, comments, please put them in the comment section below, and I just might feature your question or comment in the next episode of Ask Dr. Frida, Medical Questions and Answers. I thank you for watching. I appreciate your support, and I want you to do your best to live your healthiest, happiest life. I'm Dr. Frida.